What you'll learn. After you finish this lesson, you will be able to list safety guidelines for transferring patients. Recognize when a mechanical lift should be used to transfer a patient. Transfers. In medical facilities, patients must often be moved from one place to another. This is called a transfer. Common transfers include bed to wheelchair, bed to stretcher, wheelchair to toilet, wheelchair to car. Guidelines for transfers. Healthcare workers must provide safety for themselves and for the patients during transfers. Safety guidelines can be divided into three main areas: prepare for the transfer, during the transfer, focus on the patient. Guidelines for transfers. Prepare for the transfer. Before starting a transfer procedure, healthcare workers must prepare the patient and the equipment. Use the following guidelines as a checklist before starting a transfer. Know the correct method of transfer before you begin. Using a transfer belt is a common method, but it is not appropriate for all patients. Your supervisor will tell you which method is best for the patient's condition. Determine how many healthcare workers are needed for the procedure. Many transfers require 2 or 3 healthcare workers. Inspect all equipment, including beds, wheelchairs, stretchers, and transfer belts. Never use a damaged piece of equipment for a transfer. Prepare the patient for the transfer. Make sure the patient is wearing non-slip footwear and appropriate clothing.